Breast augmentation is one of the most common procedures I perform. I see patients ranging from their 20s all the way up to 50s, 60s sometimes for this procedure. And patients come in for different reasons. Some women just never really develop full breast tissue. Others have had pregnancies or weight fluctuations and they've lost volume and they want to restore that volume. Some patients even have some congenital issues with the breast that have affected the size or the shape. Breast surgery can be an emotional issue for patients. I think they do find comfort and sometimes are set at ease that they're talking with a woman sometimes about these issues, and I can help bring that perspective to the table too with them. Breast augmentation, is a commitment, and so I do spend a lot of time with patients talking about what it means to have an implant in place. We talk a lot about the procedure and the different options of saline and silicone implants, and depending on the person's anatomy or certain things, they might choose one over the other, and I will help them guide that. Technology has come a long way as well, and so really the devices are really excellent, very safe devices, and we can get very pretty and natural results with them. I do find that a lot of women are choosing silicone implants because it is a device that has a very natural feel. My goal is always to try to give patients obviously a natural result. Because we spend so much time talking about things up front, I think patients have very realistic expectations, and after surgery I have a very high patient satisfaction rate. I think they're really are pleased with the results. And it gives them that renewed confidence to wear the clothes they want to wear. It's typically a procedure that I do as an outpatient. Patients are out of work for a week or less. We have them follow some activity restrictions for about 3 to 4 weeks, and by about 4 weeks the breasts are really settling into shape. Patients are getting a truer idea of what they're going to look like, and by that time they're really finally excited to go bra and bathing suit shopping, and so you can really see how patients' confidence level really can change with this procedure. I always encourage women to bring their husbands or boyfriends, significant other with them, because it's good to have an extra pair of ears too to learn about what we're talking about. I think it's great to have a supportive family member to hear things as well. The other type of breast surgery I do is breast reconstructive surgery, and so many patients have undergone surgery for the breast, such as a mastectomy or a lumpectomy, and we do have a lot of ways to reconstruct the breast. Sometimes it's using the patient's own tissue, sometimes it's using implant-based reconstruction. I also see a lot of patients who have a congenital issue with the breast, so maybe one breast developed well but the other side did not, and so those are extremely challenging cases, but we have, again, great procedures, sometimes combinations of procedures, maybe an implant on one side and a breast lift on another.